Childcare, it's a fact of life, and a growing number of centers is a sign of the times. It is estimated that 85% of all families in the U.S. use childcare at some point. Beverly Hay, a mother of 3, is among the millions of women contemplating childcare for the future. Her oldest is in college, and she has a 9-year-old who's in school. But 1-year-old Nedrick currently stays with a sitter when she leaves for work. As he gets older, this will change.
As soon as he turns 3, I'll try and get him in a center where he'll be able to be involved with other kids, learn more with other kids, and that he can at least know how to play and learn how to share.
Beverly has worked at a daycare center in the past. She has some concerns about the spread of illness, but for her, the educational aspect of daycare is important. The fact is that daycare can be good for both parents and kids. A good daycare center can help a child develop creative and social skills. The downside is when you get groups of kids together, you are bound to get a few runny noses. In a daycare setting, there are ways to help limit illness and ensure a happy child. It involves choosing the right center, and doctors have some words of advice.
There are probably 3 main things to look at when evaluating daycare. One is the number of infants or children in that daycare that their child would be exposed to. Second would be the number of personnel that would be caring for the child. You want to have enough so that they're careful with the child, and there may be some educational value to a one-on-one or one-on-two interaction. And third would be just the cleanliness in the daycare, how careful they are to keep counters and hands clean.
There should be sinks for kids, and kids should be taught to use them regularly. Also, it is very important the staff frequently wash hands, especially after wiping noses, before preparing food, and after changing diapers or helping a child in the restroom. Disinfectants should be used after each use of a diaper-changing area. Tables and toys should be disinfected daily. Make sure there is plenty of space so kids aren't forced too close together. This limits exposure to illness. If it is a large center, kids should be sectioned off in smaller groups. Ask about medication. How do they store it and dispense it? Label the bottle clearly with your child's name, dosage instructions, and the doctor's phone number. And here's a tip. Ask your pharmacist to divide the child's medication in 2 bottles, one for home and one for the daycare center. Ask about the immunization policy. All children in daycare should have all of their immunizations for age. And in cases of emergencies, have workers receive up-to-date first aid and CPR training? Does a pediatrician or nurse serve as a consultant? And is there a set plan or who to call and where to go in case of emergency?
This is a dragon right here. So all 3 of these are dragons, so I made it breathing fire.
Because a child will be spending a good amount of time at a daycare, there are also psychological and developmental issues. Look for a center that fosters a child's creativity.
There should be all kinds of equipment, which we call toys, but which really is equipment and materials, for children to use in a constructive way. Children should have a lot of options for art activities, and it should be children's art and not the adult's idea of art. They need to be painting their own painting and drawing their own ideas, expressing themselves.
Overall, the sounds and scenes at a daycare center should be positive. Always visit a care center more than once and interview the staff about their backgrounds and credentials. All daycare centers should be licensed, and many will be accredited. Sometimes a child is under the weather. Knowing when to keep a child at home can get confusing. To the rescue, the CDC with a list of guidelines for parents. It offers an answer to our Kids HealthWorks Q&A, when is a child too sick for daycare? The CDC suggests that children be removed from child care programs when any of the following symptoms are present: fever of 101 and sore throat, rash, vomiting, diarrhea, earache, irritability, or confusion. Just having diarrhea is enough to keep them home. Vomiting 2 or more times within 24 hours. Body rash with fever. Sore throat with fever or swollen glands. Severe coughing. Eye discharge that consists of a thick mucus or pus, or pink eye. Irritability or continuous crying that requires more attention than can be given in a group setting. When parents don't voluntarily keep kids home, the center may be forced to send them home. So it's good for working parents to have an alternative plan. Arrange to have a friend or family member as backup for sick days when you can't be there.